Hi, Colleen Sabakbar here, talking to you today about Medicare and Medicaid. I know, fascinating. Actually, I think it's an important topic because I think a lot of people use those terms interchangeably, and sometimes it's an error, but sometimes they don't understand those differences. And it's really important that you understand those differences if you're caring for a loved one. So, Medicare is a federal program governed by the feds, administered by the federal government. And loosely stated, it is a health insurance program. And it was started many, many decades ago and was designed for people when they retired to give them an option for private health insurance because retirees were not covered anymore by their employer health insurance plan. And so they were left oftentimes in the final years of their lives without any kind of health coverage. So, da da da, in came Medicare. So, Medicare continues to be a health insurance plan, just like your health insurance plan, perhaps now, if you have an employer health insurance plan or you're on a different insurance plan through your parents or your spouse, whatever that is. It's a health insurance plan. So I can't emphasize that enough, and I've said it many times. So what does that mean? Well, okay, so you pay copays at the pharmacy. That's what Medicare does. You go to the hospital, your insurance pays. That's what Medicare does. You go to the your doctor, you break a leg and you need durable medical equipment like crutches or a boot or a wheelchair. Your insurance helps to pay for that. That's what Medicare does. Medicare is not intended to take care of your long-term health care and what we call custodial care needs. It's not designed to be long-term health insurance where it's paying day after day, year after year for coverage in a nursing home. That does not happen, or coverage in an assisted living, or coverage in a memory care. So just please know that. Medicaid, on the other hand, is both a federal and a state program. So if you are the governor of Illinois and you sign up to get Medicaid dollars from the feds, then you have to match those dollars. So if the feds give you, as the governor of state of Illinois, $1 million, then you have to have it in your budget as the governor to match that $1 million. So collectively, you have $2 million in this example to put towards services that cover your impoverished population, because that is the biggest federal program we have, is the Medicaid program. Why is it so big? Because it covers people from birth to death. It's enormous. So the one commonality that people have who are on Medicaid, regardless of age, is that they are impoverished. They meet the federal guidelines for being under those poverty guidelines, or a certain percentage of those poverty guidelines. So that's how you become eligible as a citizen in Illinois. That's how you become eligible for Medicaid benefits. So what the heck are those? They can also cover a person who needs health insurance, but more than that, it is what you might know as food stamps. We don't call them food stamps anymore. We call it the SNAP program, Supplemental Needs Assistance, I'm sorry, Supplemental Nutrition Assistance Program, which is ostensibly our food stamp program, but it is also offers cash assistance to people that do not have it. It offers non-medical services in the home or even in a nursing home. It also covers the long-term, people who are living in a nursing home long-term. Remember, Medicare is just a health insurance program. It's not there to cover long-term care in a nursing home. You either pay those out of your private funds, and once those are gone, then you use the Medicaid program. So I just really wanted to make those differences for you. Medicaid, enormous program, federal and state funded. The Medicare program, simply a health insurance program. That's really important for you to know if you're caring for a loved one or you yourself are trying to maybe get your arms around what to look for in your own retirement. Okay, hope this was very helpful, but if you or somebody you love has questions about these programs, or you need help advocating for your rights under these programs, that's what we do at Trinity Advocacy Group. So feel free to give us a call or visit us at www.trinityadvocacygroup.com, and we'd be happy to talk you through your questions. Thanks so much for watching.